So thanks for having me again. And thanks, Nicole. I would like to congratulate her. It was a great presentation, and I think I learned a lot too, because what I work is on a different aspect. So she was working on like how these people can eat what they're supposed to eat at that time. And my work is primarily what they should eat. And a little in the journey ahead of getting the dementia, because our work is primarily focused on reducing dementia risk and identifying the foods which are good for people to maintain their brain health. So we will be covering on why diet is important and what current scientific evidence we have for brain health. What are the different dietary patterns? Because that's the terminology which is used very often in the field. What kind of diet you're on, what kind of dietary patterns or combination of foods you're eating. Then I'll briefly go over some of the randomized controlled trials for dietary interventions. So randomized controlled trials are considered gold standard for any kind of research. And then I'll quickly turn and go over our recent results on if the healthy foods in your diet attenuate the beneficial effects of the healthy foods in your diet. And I have no disclosures. And although dementia overall as an umbrella term was covered by Nicole, but I again want to reiterate that the Alzheimer's disease dementia is such a common neurodegenerative disorder for our older adults, and it is a like very serious condition if gets advanced, as Nicole was saying, and then we have like different kind of challenges from to the daily activities. And coming back to the WHO action plan for dementia, we do know that currently one of the main action plan is to control the risk factors. So we have been identifying different lifestyle factors, and there have been research from 2 or more decades on like how to reduce the risk of dementia. And it's like one of the primary focus and one of the factors that is widely encouraged is to have a balanced, healthy diet. And considering that aspect, I just want to reiterate the fact that diet is not just important because we want to reduce the risk of brain health or like reduce the risk of dementia. It's also important because overall diet is giving us all the essential nutrients. It helps to maintain the healthy weight. It also helps the cardiovascular health and helps to prevent or boost up our immunity. And I think all of us have gone through COVID years and have learned some basics on diet and immunity, how it can impact. So moving forward, I will mostly focus my talk on what scientific evidence we have so far when we talk about food and brain health outcomes, primarily dementia and cognitive function. So there are different nutrients which come from different foods, and no food is consumed in isolation. So whenever we're consuming food, we're consuming combinations of nutrients. But there are specific ones which have been looked or studied for cognition or dementia a lot, and most of them are listed here. For example, vitamin E, which is very much found in nuts and oils and whole grains. And then we have DHA, which is kind of omega-3 fatty acid, which is, and one of the main source of omega-3 fatty acid is fish. Then we have quite a lot of evidence on the nutrients which are not good for you, which is saturated fat, which are in commercial products, bakeries, and other goods. Then we have a good evidence on some of the specific antioxidant nutrients, which includes carotenoids. I'm using all these terms just to make you aware because I'm going to use them again to show what scientific evidence we have. And other than that, another important antioxidant is flavonoids, which are actually the polyphenols or bioactives in the food, which are naturally present in plants. So all these have different sources in our food And here you can see in the list, we also have vitamin D, which is present in fish and dairy, which is important not only for brain health. We all know it's so much important for bone health in elderly. And then some of the good fats, I said one is omega-3 and the other one is monounsaturated fatty acids, which are found in olive oil. And then again, other polyphenols found in these natural products like olive oils, plant-based products such as teas and vegetables and other. So let's go back to these nutrients one by one and see what evidence we have. So most of the evidence I'm showing you is from the observational study design. So when I say observational study, it is a longitudinal study, most of them. So in these studies, people were enrolled. So these are all older adults who were enrolled in the study. And the first graph of vitamin E intake is the one from a RUSH cohort, Chicago Health and Aging Project, where older adults were enrolled in the 90s and they were like followed almost up to 10 to 20 years. And we do assess their cognitive behavior at certain time point and see if how they're eating and then how their behavior cognition is changing over time, or how are they developing dementia or not. So in this study, we found that people who were consuming better vitamin E, so all these lines you see are this change of cognition over time, and you'll see a lot of these graphs and lines in my presentation today, just because I wanted to show like the scientific evidence we have. So for example, in this graph, the pink line is contains people who are consuming very less vitamin E in their diet from food sources, versus all the other colored lines, or the black line or the green line, dashed lines. And you can see the pink line is such a steep decline over time versus the green or the black dashed line, where the people who are consuming vitamin E from foods were not declining as fast as their counterparts in the pink line. So this shows us the evidence that vitamin E intake is associated with slower cognitive decline in this older adults, and that's why this nutrient is important. Then similar findings have been reported for vitamin B, and here I don't have like single study, but this is more of a meta-analysis where they've put together 90 odd studies doing the similar things and found that vitamin B is associated with slower cognitive decline. Now, moving on from vitamin E and vitamin B to carotenoids. Now, what are carotenoids? These are all the colorful pigments you found in your fruits and vegetables. And there are different kind of carotenoids. You might have heard of some of them, like alpha carotene, beta carotene, lutein, lycopene. But what I want to focus here is the specifically overall total carotenoids as shown in the bubble, the blue circle. The Q5 indicates people who were consuming more of this carotenoids from the food, and we found that they have almost 50% lower risk of having dementia. So hazards ratio is telling you how much risk you have of certain kind of outcome, and specifically here we are looking at a dementia as an outcome, and we found like 0.52 means like almost 50% reduced risk of having dementia if you are consuming carotenoids in the highest quintile. And similar findings were for lutein, zeaxanthin, which is again a very important carotenoid, and this have been replicated in other studies too. Now coming on to other nutrient, it's not a nutrient, but flavonoid is more of a bioactive. So bioactive, which is found in fruits and vegetables, mostly natural compound, which has antioxidant activities. So we have looked at specifically the dietary flavonoids, and it has subclasses in dietary L-arginine, which is primarily present in berries, peas, beans, and raisins. And dietary flavonols are very much present in other kind of fruits, foods such as green leafy, beans, broccoli, apples, oranges, and tomatoes. And in this curve, what you see is the survival curve of having dementia at certain point in their life and they were followed up. So again, in this study, this is Memory and Aging Project, another Rush cohort. We looked at people at the baseline, and when they come, they enroll in the study and also let us know and observe them on what they're eating. They fill up a questionnaire on what they eat and how much they eat. And we follow them over time for their dementia diagnosis and different cognitive tests. So what we found here again was people who were in the highest quintile. So here in figure 1, you will see that highest quintile of having flavanol, which is the blue stair. I'll call it a stair. It's just a survival curve showing how the analysis was done. So the blue stair is actually much lesser or has a reduced risk of dementia when you compare it with the dark black, or is it green? I mean, it looks like dark black or green color to me. And similarly, we found similar kind of findings when we specifically look at the compound, which is pelargonidin, very much present in the other fruits and berries, I said. And we found that people, as indicated in figure 2, the red line shows that they have a reduced risk compared to the blue line, which was almost getting a lot of dementia cases over time. Now, we kind of similarly looked at different food groups also. So I said, like, there are nutrients, and nutrients are not consumed in isolation, and different nutrients come from different foods. So another aspect of looking was what are the main contributors for these nutrients, and then taking a step back and looking at the food groups. So this is a study by Dr. Martha Claire Morris, who investigated how overall the green leafy vegetables were associated with cognitive decline. Again, here, whenever you see a graph like this and a line, it's showing you the change of cognition over time. And as you can very prominently see when we compare red versus blue, the blue line is having a slower cognitive decline, and the blue line includes the participants who are consuming more green leafy vegetables. And we do control for all the confounding variables whenever such kind of analysis is done. So this is quite a robust finding that people consuming more green leafies have slower cognitive decline as they grow older. Similarly, we looked at strawberry intake, specifically overall all the berries, but strawberry was a specific question we asked in like late 90s, which were most popular berries back then. And we found that overall similar kind of findings, people who were consuming more strawberries had the reduced risk of Alzheimer's disease. So with this kind of risk, I mean like almost 24% reduced risk of getting dementia in the follow-up years. And these people were, as indicated on the graph, were almost followed up to 10 years. And on an average, people entered in the study when they were like around 79 years old. So you can see like almost if we have followed them up till 90 or more, some of them. And this is a summary for our studies and like some other studies. So the way we have done our studies, there are like different studies across the globe which are investigating different questions related to Alzheimer's disease and dementia in identifying different risk factors. And a lot of them do have dietary information and have found overall other vegetables and green leafy vegetables, as well as berries being associated with better cognitive outcomes or lower risk of dementia. However, we do not have like a lot of strong findings for fruits. Neither we did find in our studies or others, but I think berries are specifically standing out in most of the studies. Now, moving from our nutrients to one very important nutrient for brain health, and I'm sure a lot of you have heard about it so much, which is omega-3, and it's usually prescribed. People take it over the counter in supplements, but I think our main source for people who do consume fish for me will be the fish as a primary source of omega-3. And overall, why omega-3 is important? Because our brain is consisted of almost 50 to 60% of lipids. And this omega-3, one of the form is DHA, which is found in fish. It's very much required for the cerebral cortex, for synaptosomes, overall integrity of the brain. It's very much required for the connectivity of the brain. And we can say it maintains the membrane fluidity and also helps in neurotransmission. So overall brain functioning is very much related to omega-3 components. And what we found in our one of our study was that overall seafood was associated with slower cognitive decline in specifically in ApoE carriers. So ApoE is the genetic predisposition to having Alzheimer's disease. It's a well-known genetic marker or genetic gene. I mean to say a gene for having Alzheimer's disease, increasing the risk of Alzheimer's disease. And what we found in this study is we looked at different domains also for cognitive decline. I'm not going in there like for episodic semantic memory, but just concentrating on the global number overall. We found that people with at least one meal of fish per week had slower cognitive decline. And these results were replicated in another pooled analysis where we found a similar kind of effect where our studies were pooled in with some friend study and the Nurses Health study. It was found that 1 to 4 servings of fish per week may slow cognitive decline in older adults. Now, moving from nutrients and bioactives to the next piece, which will be more on the diet score, I just want to summarize and say that what we have talked about includes that the nutrients which are specifically known to have impact on brain health include vitamin E, carotenoids, and flavonoids, and omega-3, and they also do act in certain way because of their antioxidants and anti-inflammatory properties. And these are this has been shown by different studies, not only human studies, but also we have animal study evidence stating how these nutrients can help. And these are the good nutrients. But before going further, I also want to talk about another, I won't call it a bad nutrient, but something which is probably not as good for us is sugar. The addition of added sugar in the diet is not good, and that's, I think, known for a lot of reasons. For weight, for cardiovascular risk, we have like a lot of other studies indicating how soda or sweetened beverages can impact your different health outcomes. And we kind of found similar thing for sugar intake and dementia risk in our cohort, where we looked at people who were consuming the high amount of sugar, and we compared it to people who are consuming low amounts. So the dashed red line is somebody who's consuming a lot of sugar in their diet. What we found that when we followed them over almost up to 12 years, they had such a higher risk of having dementia. And we have used actually fructose and sucrose as were the primary disaccharides contributing to this, but probably I'll keep it for some other discussion. But overall, sugar was not good for having dementia, and we found that higher sugar intake was associated with higher risk of dementia. Now, why is that so? Why we think like all these different nutrients do impact brain health can come from different mechanisms. I'm not going too deep into mechanisms because I guess most of the audience might not be interested in all of it, but just to generalize on what's going around, why is this important? Because all these nutrients are helpful. Either they're helping in the neuron growth, they help in the hippocampus nerve growth, they try to make better connections and help with synapses. They are either doing the antioxidant activities and the enzymes and reducing the free radicals in our system, thus reducing inflammation or oxidation. And overall may help reduce the amyloid burden or reducing the plaque. The amyloid and plaque are two hallmarks of Alzheimer's disease in the brain. So that's the whole hypothesis, and most of it comes from animal studies, but we do have evidence from human studies stating that all these nutrients I talked about and all these food groups, they do help in either reducing the risk of dementia or having better cognitive decline. So now coming on to dietary patterns, I'll primarily talk about MIND and Mediterranean diet. And what I have here is the MIND diet, which is a combination of Mediterranean and DASH, which is called Mediterranean DASH intervention for neurodegenerative diseases or neurodegenerative delay. And then we also you might have heard about the Western diet and the Prudent diet, but I'll primarily focus on the MIND, Mediterranean, and DASH. So Mediterranean diet includes a lot of fruits and vegetables and legumes and nuts and seeds. And this diet is actually the one which was originated in the Mediterranean region, as the name says itself. So the Mediterranean diet focuses primarily on fish and seafood, and also in moderation on dairy and poultry, and limiting red meat and sweets occasionally. But most of the studies done in this region and outside also, and studies done in the US also, have found that Mediterranean diet is associated with less cognitive decline or less cognitive impairment and disease. And we do have results from one of the randomized controlled trial, which is a very big trial with a lot of participants, the PREDIMED trial, where they found that Mediterranean diet with extra virgin olive oil or nuts improves cognition over time compared to the control or a low-fat diet, as you can see in the bars here. And we recently also had another study where the Mediterranean diet was tested against Western diet in people with mild cognitive impairment and normal adults also. And here, as you can see, the results I've circled indicate how Mediterranean diet group had improved plasma biomarkers of Alzheimer's disease. However, the Western diet group, the West diet MCI group, had the worsen, have the plasma biomarkers go in other directions. So basically it worsens the biomarkers over time. Then coming quickly on DASH diet. So DASH diet stands for Dietary Approach to Stop Hypertension. This was the diets primarily targeted to reduce the hypertension and vascular risk factors. Again, it has been shown to be associated with cognitive decline, and it's primarily focuses again on fruits and vegetables and whole grains, but it also focuses on low-fat dairy, seafood, and limitations of sweets. Definitely one of the important components. Now, coming on to MIND diet. MIND diet, as I said before, stands for Mediterranean DASH intervention of neurodegenerative delay. So it's basically a hybrid of two established diets, which was actually combined together, given the scientific evidence we have so far for different foods for these diets. And it was developed here at Rush by Dr. Martha Claire Morris, who was also my mentor, and her colleagues, which was shown to actually reduce the risk of cognitive decline in our cohort over time, as it is indicated by these lines on the graph before. So these are the results from Rush Memory and Aging Project we have. And we again found that people who were consuming more of this kind of dietary pattern, which is the dashed line, you can see had slower cognitive decline. The slope is less steep when you compare with the solid line, which is the people in the lowest quartile of the MIND diet score. So overall, what is MIND diet? MIND diet includes 10 healthy food groups, and it asks you to limit 5 unhealthy food groups. And here is a brief description of what this diet will mean. So this diet focuses or recommends eating whole grains, green leafy vegetables, then berries, other vegetables, poultry, beans, or legumes, and fish and olive oil. And then the My Diet also recommends specifically limiting butter or margarine, full fat cheese, fried food, red and processed meat, pastries, and sweets. Now, why do we think this is important? And again, like I think the previous scientific evidence do speak up for some of these specific components, and the other ones are more based on the vascular risk factors and the existing literature we have for Mediterranean and DASH diet. So here are the component breakout. I just thought there's too much numbers going on in this table, but I just thought I'll put it out there in case somebody wants to have a look, and it's already published in the paper if you want to go back and look at how your mind that score is for yourself. And why just before going on to the main results from what we found with Alzheimer's dementia, I just want to highlight that Mind Diet specifically focuses on green leafy and berries. And we have seen that both green leafy vegetables and berries intake, they both reduce the risk of dementia. And that's something which is different than Mediterranean and DASH, which is overall vegetables and fruits. And Mind again specifically focuses on fish intake being one or more. Rather, Mediterranean was coming from Mediterranean region and focuses more on the fish intake. And for us, olive oil is, if olive oil is consumed more than 1 tablespoon was a good recommendation. Again, given we are dealing with American population who are not very much consuming olive oil as their primary oil. So that's most of the differences we have from the current Mediterranean and DASH diet. And these are the main findings of how Mind diet was associated with Alzheimer's dementia risk. So what we found in the first graph, which has Mind diet written on the top, that A figure is, again, this is the survival curve, the step curve, which I say to show how people are developing dementia over time. And we found people in the higher 2 steps. So these are the people who were in the high or the moderate adherence of the Mind diet. They had less dementia risk when compared to the tertile 1, which is the lowest dashed line in the Mind diet group. And we found overall that Mind diet reduces the risk of Alzheimer's dementia by almost 30 to 50%. And for Mediterranean and the DASH diet, we did also find a significant association, but it was only in the highest adherence group where we saw the difference. Now, we further wanted to look at if the diet was also associated with Alzheimer's disease pathology in the brain. So when I said initially, I think I forgot to mention in Rush Memory and Aging Project, which is an ongoing longitudinal cohort study we have at Rush, we are enrolling participants, following them over time. And these participants also consent to donate their brain at the time of death. So we have an ability to look at their brain and look at the neuropathology they have accumulated over time. And using or leveraging the data we have, we further wanted to look if Mind diet score was associated with AD pathology. And interestingly enough, so here this stain is the actual silver staining we use for identifying plaques and tangles, which are the hallmark of Alzheimer's disease. And then we there is a different scoring matrix, but then we found that people who were consuming more of the Mind diet score had less AD pathology. And this is a cross-sectional analysis. So this is more like an association of higher Mind diet was associated with less AD pathology. And what we found was that adding even one component of the Mind diet score was almost equivalent to having a fewer amyloid plaques, which was almost being like 4 years younger, specifically in this population. And then I have a summary of like other cohorts identifying the similar kind of findings where I have this summary, but probably we don't have to go over this, a whole of this, because I don't have much time. But this is, again, to reiterate the fact that there are different studies across the globe which have now shown that mind-diet association with cognitive decline or dementia risk or cognitive abilities, function. So this, to summarize, on top of what we have just talked about, primarily mind and the Mediterranean diets are the two dietary patterns which have been most widely studied when it comes to dementia outcomes and the other imaging outcomes also which are related to dementia. So we have evidence on how Mediterranean diet is associated with better brain volume, better gray matter volume and cortical thickness, and less of white matter hyperdensities and infarcts and beta load, amyloid load. And we also have evidence how mind diet is associated with total brain volume and AD pathology, which I just shown you before. But definitely we do need more evidence in this space to further identify how it helps. And there are certain ongoing trials with the mind diet, and some and one of the trial, the mind intervention trial is over, and I'll just share the results for that too. So the mind trial, which happened at Rush, was a multi-site trial at Rush and at Harvard for older adults 65 years and old with a history of Alzheimer's disease or dementia. Means like in the family they have someone with the disease, and these were overweight or obese people with suboptimal diet who were followed for 3 years, and almost 604 people were recruited, and they were randomized into two groups. One group was given a Mediterranean diet and the other group was given the weight loss diet. They were coached over time with we have registered dietitians who were constantly with following up with these participants and how they're doing, and different cognitive assessments were done over the period of 3 years. And here are the main results which were published last year, where we found that both the mind and the Mediterranean diet, both the mind diet and the control diet, which was the weight loss diet, when people were following it, there was an improvement in their cognitive function over time at year 3. So here is the cognitive function graph, the global cognition score, which you see is increased overall in year 3 when people were either on the mind diet or the low fat or a mild calorie restriction diet. Then there is currently an ongoing US pointer trial, which is Alzheimer's Association funded, which is a 2-year clinical trial for different lifestyle interventions, which it has mind diet as one of the components in the trial. But the trial also emphasized on other lifestyle factors like physical activity, social and cognitive activities, and then management of their health and cardiovascular features. But mind diet by itself was also found to be associated with other kind of health outcomes, which are primarily very common in older adults, such as disability. So what we found in our cohort was people who were on these kind of healthy diets, such as mind, Mediterranean, or DASH. They had reduced risk of developing ADL disabilities or any kind of instrument activity of daily living disabilities or mobility disabilities in over the course of follow-up. We also found that people on the mind diet were developing less Parkinsonism, they were showing less than Parkinsonism is having 2 or more Parkinsonian signs prominently present. And we overall found that people on the mind diet overall had slower progression of these Parkinsonian signs when followed up for the longer time. We also found mind diet association with depressive symptoms in our older adults, which was again reiterating the fact that the diet is not just helping cognition or dementia outcome in these individuals, it's also helping some of the other mental health outcomes as well. And now coming on to the last piece, I think I should be able to do it in another 4 minutes. 4 minutes is what I have, right, John? Yeah.
We have probably about, I think, 10 minutes.
Oh, okay, good. Okay, so I've been trying to talk very fast. Okay, So just this is the last section on does unhealthy food component in your diet attenuates the beneficial effect of healthy diet. Uh, and this question arises because you are like going back and forth with different kind of diet patterns, and in some diet patterns, some things are captured, and then in other, there are different ways of scoring your diet in combination. So when you report certain foods intake, and we wanted to see if people who are consuming, because we found people in our cohort who were consuming all these recommended fruits and vegetables and fish and meat, but then they're also consuming the unhealthy items, such as like fried foods and a lot of sweets and a lot of other kind of maybe like quote unquote junk food. So we wanted to see if that contributes in a way to your overall health. And we specifically looked at two diet scores. So we picked up the Western diet score. Western diet is the diet score where we capture how much red and processed meats or organ meats they're eating, including butters and the fried foods and the refined and the sweet foods. And then we use the Mediterranean diet overall score, where we do use the fruits and vegetables, legumes and whole grains and olives and fish. And we did not find a lot of good correlation between these two diets. Otherwise, I mean, although you would expect somebody, if he or she's eating good foods, they're not eating a lot of bad food, but that's probably not always true. So there were some overlaps. And just to see how if the overlaps work, we divided our study population into two groups. So we had this low Western diet group and a high Western diet group. So high Western diet groups are people who are eating more of these fried foods filled with more sugar, more fat, more of the processed meats and stuff. And then there was this low Western diet group who were eating less of these food. But when we divided them into two groups, we wanted to look if the Mediterranean diet, which is a healthy diet, has the same impact on cognitive decline. Again, these people are followed for a longer period of time. We have been observing them and looking at their cognitive scores over time. And these lines also indicate the similar kind of change over time. If you see a steeper decline, means they have been declining faster. So let's see how these two graphs look. So if you look at the low Western diet graph, the Mediterranean, the gray line is the highest tertile, and the yellow mustard line is the middle tertile. And we found that both these lines are declining less than the blue line, which is the steeper or a low Mediterranean diet score. However, in the high Western diet score, we somehow see that the tertile 2 lost its effect, like the T2 is declining faster, and the gray line was also not very much statistically different than the blue line. We kind of lost the significance somewhat in the high Western diet group. So overall, if I summarize of what we know so far, we know different nutrients are important. We know different food groups are important. We have looked at different diet scores, which are important to reduce the risk of dementia. And there are some studies in mild cognitive impairment showing that these diets do work. And we also know that a lot of consumption of unhealthy foods can attenuate or reduce the beneficial effect of healthy diet you're consuming. But I always say that there's more to this puzzle of diet and dementia and what works and what does not work. Again, probably this is also comes back when you're in advanced stages to more personalized approach, like what you can eat, how much you can eat. And I always encourage like to consult your dietitians or nutritionist around to have the best possible regime for yourself. But there is more to the puzzle in a sense. We have limited information on how diet impact diverse populations. So there is less of underrepresented groups here, which we have not been able to study until now. But now, given that there's more inclusion, we will have more answers. And then there's also comes a question on food accessibility and food environment, like what kind of food is available in your more or closer grocery store, or your people, or how much can you go and buy, and how can you best use the resources available in your area. Then there is the social determinants of health, which is again more umbrella term, which we have used a lot, but then we still are narrowing down on how to reduce the gap using these approaches, because that can overall impact your diet, your nutrient intake. There is a lot of food insecurity in some sections still. And we have to concentrate if their food environment is good enough in the grocery store. Are you getting a good option of the fruits and the vegetables, or if even if there is a canned or a frozen food, does it have like, do you get low sodium options? Do you get good enough options to include in your diet? And then more this has to come in this field, given that there's so much research going around right now. I think we'll in near future have more answers when it comes to precision nutrition as being one of the primary approaches for neurodegenerative disorders, because it is coming up, like your metabolism is different, you have like different underlying conditions. There are so many other things you have to take into account when you are trying to design or develop specific dietary regime for your patient or person with certain risks, etc. With that, I would like to summarize my talk overall. So we have seen quite a lot of scientific evidence so far, and I have tried to summarize a lot of it. There is more out there, but overall there is very compelling scientific evidence on specific foods and nutrients for their role in brain health. And what we have seen today is that antioxidant nutrients, including vitamin E and carotenoids and bioactives, B vitamins, and omega-3 fatty acids, do help cognitive outcomes in older adults. Giving what is being done with different dietary patterns and specific foods, there is more of a recommendation to eat green leafy vegetables and other vegetables, berries, fish, nuts, olive oils, legumes, whole grains, poultry. And then there are some foods specifically that should be avoided, like processed red meat, full-fat cheese, fried and sugary foods. Overall, healthy diets such as Mediterranean or Mayan diets do relate very well in reducing the risk of dementia or slowing down the cognitive decline or motor decline in older adults. And the ongoing and future intervention trials with the Mayan diet may give us more answers in how well we can establish these findings in the future. When emphasizing the healthy foods, and that's what we see with our last segment with the unhealthy and healthy foods. So it is very important that when we're emphasizing the healthy foods for cognitive health, as per the recommendation, we are also emphasizing on avoiding the unhealthy foods such as red meat and those which give a lot of sugar in the foods, or other foods such as fried foods or refined grains.